spoke with my doctors back in New York, and I spoke with the doctors here, and they all recommended surgery. That is the standard procedure, that they recommend. And but I was like, okay, so what's going on for this nodule? I need to remove my whole thyroid.
So on that note, Dr. Kandil, so Elizabeth comes in to see you. Tell us what happens.
So we always discuss the options for the patients, and definitely surgery is a valid option for patients like these with suspicious nodule with the biopsy. But we discussed that we can proceed with the ablation and see what's going to happen. If there is a good response and we have a good control, we can save the thyroid and avoid surgery. Again, I mean, I love what I do and I love doing thyroid surgeries, but we decided that we're going to try the minimally invasive option, no surgery, no need for medications, and I think we did really well.
Hello everyone, Philip James from the Dr. Thyroid podcast. And today I'm in New Orleans at Tulane University. I'm seated here with Dr. Kandil and Elizabeth. Elizabeth had a thyroid nodule and it was treated without surgery by Dr. Kandil. But the thing is, when she was researching how to treat her nodule, she was looking in New York and doctors were advising her to do surgery. Is that right?
Yes, absolutely.
Can you tell us a little bit about that?
So basically, I discovered to have these nodules. I mean, happened years ago when I had those small nodules, and they weren't they were so small that the doctors over in New York City, they told me, look, there is nothing to treat. They look okay. There is nothing to worry about. Happens that my primary care physician told me, well, maybe it's time to go and check them again. And when I checked them, I mean, the results came back as tier 4 and one suspicious tier 5. So, you don't expect that. And I started to worry, okay, what do I need to do now? And so I spoke with my doctors back in New York, and I spoke with the doctors here, and they all recommended surgery. That is the standard procedure, that they recommend. And but I was like, okay, so what's going on for this nodule? I need to remove my whole thyroid. It's a big deal removing the thyroid because it balances everything for us. And so my primary care physician told me, well, there is something that you can do. There is this amazing doctor here in New Orleans, and you're lucky that you're here. I was like, oh my gosh, maybe this is a sign that I needed to be in New Orleans, So Dr. Kandil at Tulane does this relatively new procedure that is the ablation. And I said, well, I need to see him, I need to meet him. And so I did. He found the space for me, and it was, everything went perfect because they found this nodule. He was suspicious, but he said, we can do it, I can do it, I can treat it. And he did.
So on that note, Dr. Kandil, so Elizabeth comes in to see you. Tell us what happens.
So we always discuss the options for the patients, and definitely surgery is a valid option for patients like these with suspicious nodule with the biopsy. But we discussed that we can proceed with the ablation and see what's going to happen. If there is a good response and we have a good control, we can save the thyroid and avoid surgery. Again, I mean, I love what I do and I love doing thyroid surgeries, but we decided that we're going to try the minimally invasive option, no surgery, no need for medications, and I think we did really well. We just did the ultrasound today and shrunk like over 9%, so just outstanding. So definitely no surgery.
And Dr. Kandil, Elizabeth shared her story how one of her good friends in New York had her same symptom, thyroid nodule, and they treated it with a thyroidectomy. The question for you is, and she was even saying when she was in New York they were recommending surgery, Why do some doctors recommend a surgery when it's not even necessary?
I would not say it is not necessary. I would say there are other options, and patients should have the ability to know and the right to know about their options and make a decision. So when you have a suspicious nodule for cancer, you worry about it and you might want to remove it. But the truth is, most of the thyroid cancer nodules are not bad and can be actually monitored and do not even need an intervention. We can do something called active surveillance. And in some cases, we really need to do an operation, but you need to see an expert to know your options. But in this case, we decided that we're gonna undergo the non-surgical option, and we had an excellent results, over 90% shrinkage, exactly 93% shrinkage with the volume reduction rate. So I think we were able to save the thyroid. So, and it's not about having surgery. I mean, surgery is a big thing in life, and it affects the quality of life. But there are possible complications that can be related in addition to undergoing general anesthesia. More importantly, preserve one of the most important organs in our body and keep the thyroid hormones coming from our own factory.
So for example, with her case, if a surgery would have been performed, not by you, by somebody else, would you call that an unnecessary surgery?
I would not say that again. I would just say that she did not have all the information that she needed to know prior to the procedure. One thing about thyroid cancer or suspicious nodule, that we had a very large series, over 100 patients, where we looked at biopsies afterwards. And it's amazing, 2/3 of these patients would not have evidence of cancer afterwards from the repeat biopsy. So this technology has been out there for 2 decades to treat bigger real cancers like liver cancer, kidney cancer, etc. And now we are treating small cancers with it. And talking about suspicious nodules, there is a very great study looked specifically at RAS mutation. The study is multi-institution, 3 institutions led by the Memorial Sloan Kettering in New York. And they divided patients into 3 groups. Patients who decided not to do anything, and patients who underwent surgery. And the 2 groups from surgery divided into like patients who had benign disease or cancer. So the patient who underwent surveillance, no surgery, no growth, no increase in size. Patient who underwent surgery, the vast majority were benign. And the one that had cancers, the cancer was very low risk for recurrence by the ATE stratification, by the American Thyroid Association stratification, to give us an idea about which one have a high risk for recurrence or not. The conclusion of the paper that we should not just be operating on all these patients. I think patients have the right to really understand their options and choose from these options.
Elizabeth, if there's a patient watching right now, they have a thyroid nodule, and you said you had a friend in New York who had similar to you but ended up having a surgery.
Yes.
What advice would you give to somebody either listening to this interview or watching it that has a thyroid nodule?
To check all the options, because I mean, times change. This is 2024 and we have new resources, and it's been such a blessing for me to have the chance to meet Dr. Kandil and have this choice to don't have a surgery, to don't have a big scar, to don't take medication every day for the rest of my life. And not, it's like medications are good to treat something, but there is always side effects. And medication it's not a substitute for an organ. It's never going to be the same. So for who really needs it, absolutely, surgery is probably what they need. But if there is a chance that your problem can be treated with an ablation that is minimal invasive, it's really a little thing. The recovery time is almost nothing. And the treatment, I mean, in the matter of 15 minutes, 20 minutes, you're done. And you walk home, and you go back to your family, and everything it's been treated. And in the following year, you find that everything is gone because it worked. I mean, why don't take a chance to save it, to save your thyroid, and try the new things that, of course, it's been already around for 10, 20 years, but there is knowledge. There is the fact that you need to know your options, and then from there decide what to do. But absolutely, for me, it's been a game changer because.
You see, Philip, I know Miss Elizabeth now for like a year. Every time when I see her and the numbers are good, the smile, the happiness is much better than. Imagine if I take this thing out and it's not cancer. She was not going to be happy.
No.
But,
He's scared of me. I'm like,
no, but now we are both happy. So
yes,
things are good. It feels
absolutely.
really good.
Dr.
It's very
Kandil.
fulfilling.
Yeah, I can tell, and I can tell you're very passionate about your decision to avoid surgery.
Absolutely.
And to have found Dr. Kandil.
Yes.
Dr.
grateful.
Kandil, before we say farewell, somebody watching, they have a thyroid nodule. What do you tell them?
Well, it's important to have this worked up by someone who knows what they're doing and have experience, and you need to know all your options. Many of these nodules, the vast majority are benign, and if they are suspicious, before doing anything, genetic markers is something that we can offer to look at the details of this. And if it's cancer, most of the cancer is very early stage and can be managed with non-surgical interventions too.
Mm-hmm.
And patients have the right to understand all these options at this day of age.
Wherever you're listening to this interview or watching it, if you look at the description to the episode or the video, you'll find the contact information for Dr. Kandil. For now, we're going to say farewell. Thank you.
Thank you, Elizabeth.
Thank you.
Thank you, Dr. Kandil.
Thank you.
See you guys.